We will now demonstrate tracheostomy care. For tracheostomy tube cannula and stoma care, please gather sterile normal saline solution, prepackaged sterile tracheostomy care kit set, handheld resuscitation bag connected to an oxygen source, stethoscope, disinfectant pad, and it's highly recommended to have personal protective equipment. For preparation of equipment and implementation, place equipment and supplies on a clean table or stand near the patient's bed. Perform hand hygiene. Put on gloves and other personal protective equipment as needed to comply with standard precautions. Open the tracheostomy care kit using sterile technique. Using sterile technique, pour sterile normal saline solution into one of the sterile solution containers. And then pour sterile normal saline solution into the second sterile container for rinsing. For intercannula care, you may use a third sterile solution container to hold the gauze pads and cotton-tipped applicators saturated with normal saline solution. Hydrogen peroxide is no longer recommended for cleaning intercannulas or tracheostomy sites. Confirm the patient's identity using at least 2 patient identifiers.
Could you tell me your name and date of birth, sir?
Ted Stillman, 11/20/84.
Explain the procedure to the patient to allay his fears and enhance cooperation. Provide privacy. Assess the patient's respiratory status for baseline comparison. Help the patient into the semi-Fowler position if possible, or place him in the supine position with the head of the bed elevated as tolerated to prevent aspiration of secretions and to promote oxygenation. Hyperoxygenate the patient for 30 to 60 seconds. Cleaning a non-disposable inner cannula. Put on sterile gloves. Using your non-dominant hand, disconnect the oxygen source. Unlock the tracheostomy tube's inner cannula by rotating it counterclockwise. Remove it 6 to 3 and place it in the container of sterile normal saline solution, but don't allow it to soak. Place the oxygen over or near the outer cannula to maintain the oxygen supply. Working quickly, use your dominant hand to scrub the cannula with a sterile nylon brush. You may also use this sterile pipe cleaner, if necessary, to clean the inner cannula. Immerse the cannula in the container of normal saline solution and agitate it for about 10 seconds to rinse it thoroughly. Inspect the cannula for cleanliness. Repeat the cleaning process if necessary. When it's cleaned, tap it gently against the inside edge of the sterile container to remove excess liquid and prevent aspiration. Alternatively, you can use a pipe cleaner to dry the inside of the inner cannula. Don't dry the outer surface because a thin film of moisture acts as a lubricant during insertion. Reinsert the inner cannula into the patient's tracheostomy tube 3 to 6. Lock it in place and then gently pull on it to make sure it's positioned securely. Reconnect the oxygen source.